Hello, everyone, and welcome back. Today we have our expert Medicare guide, Ellie Jolly, Ellie Jolly, joining us once again. And today she is going to tell us about Medicare Open Enrollment as well as the upcoming changes to Medicare Part D. So, Ellie, I guess we'll just hop into it. So, can you briefly just explain what Medicare annual enrollment what is the Medicare annual enrollment period, and why is it important for seniors to pay attention?
Yeah, so I would imagine that a lot of folks that are on Medicare, that are Medicare beneficiaries, are already getting phone calls and emails, and we're going to talk about that too, because the activity from the marketers is heating up already. So Medicare annual enrollment is a period in time every year when folks that have Medicare Part A and B can make a change. So if they're on original Medicare, they can pick up a Advantage plan. If they're on an Advantage plan, they can change their Advantage plan. And that's why agents like me, we like to be sure that we are getting with our folks and we are looking at all the plans and we understand what's most important for our clients so we can help them find the right plan. And you hear that terminology a lot, but really it's hard to do that by yourself, and it's hard to do that with someone like a telemarketer that calls you over the phone. It's that's a hard thing to do. So I know I'm doing my 2025 training now as we speak. I've gotten the big Medicare training done a few weeks ago, believe it or not. And I'm going through all of the insurance companies' trainings, and we're about to start getting together with the insurance companies. They're about to start having all of their 2025 first looks. But we are not allowed to talk about plans for 2025 until October 1st. Annual enrollment
Okay.
will begin October 15th, and it's about 6 weeks of chaos. It is a flurry of activity. So you have from October 15th to December 7th to make a decision. And the last application for an insurance plan that you put in that hits Medicare's, let's call it a desk, that is the one that stands come January 1. So people can, that's why there's so much calling and mailing, and there's so much activity. And we'll talk about the rules so people can understand what's allowed, what's not allowed, and who they should hang up on.
Okay. And who they should hang up on. I
Yes.
like that. Well, my next question was about the dates, but you covered that. So it begins October 15th and runs through December 7th.
And
Now,
agents we can talk about plans starting October 1st. We're allowed to, even though we will have been, I probably will know some things come August, end of August. Can't really get real specific and start sharing the plan details with folks until October 1st. But
okay.
can't do
Oh,
anything with that until October 15th.
gotcha. Okay. So, what factors should seniors consider when choosing a Medicare plan during their annual enrollment period?
Well, first of all, like I said before, you certainly don't have to call me, even though I'm here in Northwest Atlanta. You don't have to call me, but you should definitely work with a licensed agent to help you, because as a broker, I'm familiar with hundreds of plans, and I'm appointed with a bunch of the insurance companies, not all. And we have a new insurance company coming to Georgia this year for 2025. Devoted is joining us this year. They're in Florida and Ohio and a lot of other states, and people seem to
Okay.
be really happy with them. So excited to see what those plans look like. But um, and we're going to talk about this in a minute, but there are some big changes coming when it comes to how the Part D prescription coverage works. So this year, more than any other year, it's really important to sit down with an agent and talk about your prescriptions and be sure your prescriptions are still going to be covered. And your doctors are still in the network because they're negotiating those relationships right now. So we want to make sure that the doctors are still in the networks. And then we can talk about, hey, do you need to get dentures this year? Like, who's got the biggest dental allowance? We can talk about
Mm.
things like that. But I always say, the formularies, the way that the companies cover the prescriptions change every year. And this is going to be, this is going to be a big year for that. So it's critical to double check the prescriptions, and the provider relationships change every year. It's critical to check those too. I know we've had some years where Piedmont, for example, has been an issue with one of our most beloved carriers in the Atlanta area, and they work it out. But things like that, there's contract negotiations going on in the summer. So we got to check all of that first thing before we even get into, all right, you need dentures this year. What do you need this year? Because most of the Advantage plans on that side of things have dental, vision, hearing.
Okay.
Folks that like need hearing aids, for example, we've in the past we've been able to find them. All right, who's got the biggest allowance so you can get them this year, right? You can get a good pair. So things like that are important to talk with your agent about, but start with the prescriptions because this year is going to be a little crazy.
Okay. Wow. Okay. Okay. So, how can someone assess whether or not their current plan is the best option for them? I mean, it sounds like it's something that you really shouldn't try to go alone, but how could you, is there a way that you can kind of self assess if your plan is the best plan for you?
There's two things about that. By September 30th, all of the carriers have to send out an annual notice of change. So people will be getting those ANOCs in September. That's going to give them the first idea of what's changing, right? And then, like I say, October 1st, if you've got an agent, you should make sure that they have your revised prescription list. And any new doctors you've picked up since you last talked to them, make sure that they've got them so they can be on top of running comparisons. Now, you can try to go it alone. Medicare.gov, you can put in your zip code. The plans are all different by zip code. Like I say, there's hundreds of plans and they're all different by zip code. The carriers, some of them have, there's multiple plans by carrier. And like I say, we get into where there's hundreds of plans and every zip code is different. So,
I didn't realize that it went by zip code. I assumed that it went by state. I thought
no,
that, maybe they might drill down to county, but it's as specific as zip codes.
they are not, all plans are not available statewide.
Really?
No, they are not. So that's why the first thing that, I'm like, okay, zip code, please.
Right.
That's the first thing. And then the doctors and the prescriptions.
Okay. Okay. And one thing you mentioned, going back to talking about the last thing that hits the desk. So let's say you speak to someone and you decide to change your plan, and you realize that maybe that person didn't do the research that they should have done for you. So you can change again, or is it just once you change it, you're done?
Unfortunately, and I say that because there is so much chaos and there's so much confusion, and I've seen this hurt people. Unfortunately, you're allowed to make multiple plan changes during annual enrollment.
Mm.
It's the last one that hits Medicare's desk that's going to be the one that's going to stick. And then, there is a way to get out of it come January. There is an open enrollment, but we're not even allowed to market that. That's not something that we are supposed to really talk about a whole lot. But there is a way to make a change if you don't like the plan you've got come January. But you want to be really careful. And the other thing about that is this is another reason it's good to work, just like it's good to work with a realtor, it's great to work with an agent because if you are my client, I can keep an eye on my book of business, right? I'm able to see, like for example, in Humana, I can go in and see is there anybody that's pending a disenrollment, right? I can see
Mhm.
these things. So I know if a telemarketer has gotten to you and potential or someone has gotten to you and potentially maybe you meant to change, maybe you didn't mean to change. And a lot of times it's they got on the phone with someone and the words were tricky and it sounded great and they said yes and boom their plan was changed and they didn't even know it. That happens a lot.
Yeah. So let's talk about that, because you mentioned telemarketers, and most of us have a senior in our lives, or two or three or 10 of them. I know my mom talked about how her phone would just ring off the hook, as well as, my aunt. And she was just nervous to even answer, because she has had the experience of changing her plan and then it not being the best plan for her. So, how can seniors protect themselves from scams, and not even just scams, but maybe, um, I guess, representatives that don't necessarily have their best interest at heart?
And I have taken some information off of the Medicare.gov website, and I have been going to senior centers and apartment buildings where seniors live, and sharing this with anybody who will listen. And I reach out to me, I will come to your building and talk about this. But there are rules that licensed agents, who are licensed by the state of Georgia, um, have to follow in order to be compliant and to work with Medicare products. Okay. Um, Number one thing is we are not allowed to call people. We are not allowed to place, I can't, if someone tells me to call you, I'm not allowed to call you unless I have your permission to call you. You can call me and I can call you back, or you can sign one of my little permission to contact forms, right? If I meet you,
Hmm.
without this, or without you calling me, without me being sure that you want me to call you, I cannot call you. So these telemarketers, and the other thing is, now what we are allowed to do is send mail. We are allowed to send you postcards and letters and mail. So your mailbox is going to be full, but we are not allowed to call you. And so and also, by the way, we are not allowed to come to your house. I know people, you've probably heard this too, who have had people drive up in their driveway, knock on the door. One agent, gave someone their card. These are prohibited activities. This is completely not compliant, and we could have our licenses revoked ultimately for these kind of things, right? And we could have complaints filed against us in the state for doing these things. So I don't know why people do this. But had someone roll up, knock on the door, gave them their business card, said, I'm going to be in the area this week. You can't do that. And here's a gift card. Another thing we're not allowed to do. We have strict limits on, like, if I have an educational seminar and I'm talking about this, I always bring snacks, right? But I'm only allowed to spend so much money, and it's a little tiny bit of money per Medicare. I'm only allowed to spend a little bit, and that's it. And there's such strict rules. I mean, so I have this sheet that I hand out, and let's see if I have one out of here that I can show you. But it's front and back. It's all the rules that we have to follow per Medicare. Okay, so
So, who are these people that are calling?
that's a great question. So in America, okay, the telemarketing business is really governed by the FTC, right? First thing I tell people is make sure you are on the do not call list, first of all. Okay. And you can go to donotcall.gov and you can put in your number and you can see if you are already on the list. You will never come off until you take yourself off. You can check your number there and see if it's on the list. If you need to sign up, you go there, you put in your number. They require an email address, so you would have to put in your email address, and then they will immediately send you an automated email from donotcall.gov. So you'll know it's from them. You click on that email, it verifies this person is legit, the phone number is legit. Boom, you're on the do not call list. Now, what does that really mean? All right, well, companies that are in America, that are here, have to follow the laws, okay? And the thing is, like, if you're on the do not call list and you get a call, by the way, robocalls are not allowed per the FTC. They can't be doing that. But these callers, a lot of them are robocalls. If you pick up the phone and there's a pause and a click, and then they say, hello? No.
Hmm.
Hang right up. No, that's a robocall. It's not even allowed here. Okay. The other thing is if they say, please hold while we connect you. No, click, hang up right away. Don't take that call. Okay. The FTC also has a way to forward texts that you get, by the way. You forward a text that you get that is spam, and I get these. Your Amazon package can't be delivered. Click on
Me
this
too.
weird, strange looking link, right? It's not an Amazon.com link. That's not true. It's a scam too. Um, Forward that right on to spam. That's the FTC. You could forward text to them too. So every call that like the FTC, it does go after companies here that are based here that are trying to follow the laws, right? That are supposed to follow the laws. They do go after them. If we report them to the FTC, we're on the do not call list. We've not given them permission to call because that's the key. Any business can call you if you filled out a little form on social media or something like that. A lot of people don't realize that they're giving companies permission to call them.
Right.
So be careful on social media what you click on and what you apply for and where you share your phone number. Because if you've given them permission to call, well, heck, they're calling you. And we all know that a lot of businesses sell our information, right? So, and there may even be a disclaimer. You may have checked okay and didn't read it and didn't know. And so now you're getting calls that maybe are not protected by the FTC because you gave them permission. But if you're
Hmm.
on the do not call list and they call you and you did not tell them to call you, they're breaking the law. And if you tell the FTC that this phone number called me, you can report those online as well. Do you know that they go after them and prosecute them? And it is the fines are it's $50,000 per call. It's a lot of money. It's a big fine.
Who gets the fine?
Oh, I guess the FTC must get that. I don't know. I don't know. That's a good question. But I thought, I read that online and I thought, wow, $50,000. I'm not calling anybody.
Right. I'm not calling anybody. And if they are calling me, I'm reporting it and I want the 50 grand.
But now here's the problem. Remember what I said. That is an American law for
Right.
American companies. So if they call you and you've not given someone permission to call and you pick it up, and even if it's from a 770 number, it doesn't matter. They have all of this technology, this spoofing
Mhm.
technology. They can mask the number and make it look like whatever number they want. I had a
Right.
client that told me that she had been to Talbot's to return something, and the call that came in was from Talbot's. It wasn't Talbot's. It was another Medicare call. And it was someone with a foreign accent. And so probably calling from overseas. I mean, I'm not saying that that's always the case, right? Also, if they tell you, I'm calling on behalf of Humana, I'm calling on behalf of Cigna, no, because if they start asking you for personal information, y'all know that your insurance company knows more about you than you know about yourself. They don't need your Medicare number. They
Mhm.
don't. If they're calling you to offer you more benefits from their company, they have your information in front of them. They don't need you to confirm anything. Okay.
Right.
So protect your Medicare number at all costs, just like you would your Social Security number. I wouldn't even carry it with me unless I had a supplement and I had to take it to the doctor. I wouldn't carry it with me. I would laminate that thing and file it away with my Social Security card. I would never. But back to the phone calls, it's a problem, and a lot of them are not legitimate insurance agents. That's what I'm saying is we have 2 pages of rules here. We have to do
Right.
training every year about the rules to make sure we know how to be compliant. I'm not knocking on your door. I'm not calling you unless you give me permission. I'm going to make sure that you fill out this scope of appointment before I meet with you. Medicare requires that. It's a permission slip basically for agents to
Right.
talk to you about your Medicare. And we have to do that 2 days before we talk to you, sit down and talk. There's a few exceptions, but I mean, there's a lot of rules. So we cannot walk up to your door, knock on your door, not allowed. That's not, if they are a licensed agent in Georgia, you could report them and you report them to the Office of the Inspector General and you file a complaint. And then it's researched and then they're going to have some trouble. Okay. Um, if they call you and you haven't told them to call you, they're not following the rules. They're not following the Medicare rules, and they're certainly not following the FTC rules. So then you got to wonder, is this company in America or are they offshore? And if they're trying to ask you for any kind of information, you do not give them your Medicare number over the phone. Don't give them anything because they can even just get your birthday and your last name and first name. They're calling you. They should know something, right?
Right.
So,
Right. That's
um,
very true. That's very
so
true. And I think those are rules to follow just across the board, not even just with Medicare. When people are calling you and asking you for information, that should be your first warning sign that it's not a legitimate call and to just hang up.
it's
To
exactly
just hang
right.
up. Yep.
And honestly, on your phone, a lot of the carriers I know have things that will alert like possible scam, and that's great.
Mm-hmm.
Use that at all, but for sure. But I know the Apples and the Androids do have a setting on Apple. It's under settings, under phone, and you go to settings, you go to phone, and under there is a silence unknown callers thing. You can just slide it over, turn it on, activate it, and then your phone doesn't ring. They show up, missed call, doesn't ring. And here's my biggest piece of advice. If that happens and you didn't answer it, good for you. Don't answer calls that you don't know. Don't. Anybody who needs you will leave you a voicemail. If
Right.
it's the doctor calling to schedule an appointment, you can call them back. They will leave a voicemail, right? Anybody legitimate trying to reach you is going to leave a voicemail, but you know who won't leave a voicemail? Anybody who's trying to scam you out of your
Scam you.
personal information. You
Yep.
know, and most
That's
telemarketers won't leave a message either. Some do. I don't know. I keep getting calls for who is that cable carrier? I keep getting weird calls from about that. I'm like, what, are you here in Georgia?
right.
Why are you calling me? I need to report them to the FTC because I have
Exactly.
not given them permission to call me. You see?
Very true, very true. Well, I know the other thing you mentioned was that there's some changes coming up in for
Oh boy.
2025 for Medicare Part D.
Oh
So
boy.
I know you talked about Medicare Part D on our first interview. So if you'll just refresh our memories on what Medicare Part D is and then tell us about the changes.
So there was something called the Affordable Care Act that was actually passed, I think it was under Trump's administration before. It was like 2020. They passed this act. Well, every year there's a few little more things that are like executed every year. This year, 2025, this is the big year. The big change is so you asked me to back up and explain. Part D is our prescription drug coverage under Medicare. It's not free, you buy that. And it's included in a lot of Medicare Advantage plans. It's just wrapped right into it. So this is going to affect you if you are on a Medicare Advantage plan or if you have purchased a standalone drug plan because maybe you've got a supplement or maybe you're using original Medicare A and B. Anyone who has any kind of drug coverage with their Medicare, this is going to affect all of these people. This year, the way it works is there's something called the donut hole that is not popular. This is not a yummy donut, okay? This is a hole that you fall into based on how much money, like they're tracking the true out of pocket dollars and cents all year long on your prescriptions, right? Sometimes there's a deductible first, and then you roll into the initial phase, the initial coverage phase. This year, that amount between the manufacturer discounts and what you pay and the value of the drug, what the insurance pays, there's this big complicated formula, and it you get to an amount of $5,030 this year. And then you fall into the donut hole or the coverage gap. And now you're paying a whole lot more. Okay. Now your share of the cost of the drug is higher. And then you come out of it at $8,000 out of pocket. You're not really out of pocket $8,000, but all in this true out of pocket cost is added up $8,000. Great. Now you're in what we call catastrophic coverage, which sounds really terrible, but that's when all of your prescriptions are now covered 100%. You don't pay any more out of pocket. I said $8,000, right? Even though you're maybe not out of pocket $8,000, still you're out of pocket a lot. So next year, that donut hole is finally going away. There will be no more donut hole. Okay. So there still could be a deductible with some carriers, and then you're still going to go into an initial tier. But guess what? The cap is not $8,000, it's $2,000. It's a lot less. And that's not, again, not just your out of pocket amount, okay? But $2,000. And then once your spend is, you hit $2,000, you go into catastrophic coverage now. And then everything is covered. Now, here's the challenge. And this is why if you have an agent, you need to sit down with them in October, right? Because here's the challenge. The way that this is going to be paid for on the back end, the insurance companies are picking up. I've heard them say 3 times as much of the bill as they have this year. Right? They're picking up more of the cost as opposed to the drug manufacturers. You would think that they're having to put in more discounts. That's not the way it's working. The carriers are actually going to be footing a little more of the bill. that worries people like me that are in the risk management business, right? Because how are they going to pay for this? So what are they going to do? Are they going to take drugs off the formulary? Are they going to standalone drug plans for folks that have supplements or original Medicare? Are they going to raise those premiums? We've heard some of the carriers already say that they are losing money, and that they're going to be cutting some of the benefits. And we wonder if that will that be dental? Will that be, what are you going to cut? Right. So we don't know yet, but we're concerned and we're anxious to see the plans to see, so how is this going to work, right? I mean, their insurance companies are in business to make money. It's not a nonprofit, right? So how are they gonna comply with the new rules? I don't know yet. So that will be interesting to see. But it's a great thing for people that have expensive prescriptions that do hit the donut hole and do make it to catastrophic coverage. It's a great thing for people. There's another thing coming that I almost hesitate to mention, but I want to mention it. Just know that the details for this are not all worked out. But anyone that has, if they have a really expensive prescription, and let's say it's like, ooh, you're paying $600 or something crazy like that for a prescription. Um, Medicare is now bringing out this thing where it's a payment plan. That's going to be a new thing. The carriers will run this. So if you have a prescription that's like $600 or something, and you're really quickly in the year, let's say by March, you're at that $2,000 mark because your prescriptions are so expensive and you just don't have the $2,000 to put out in 3 months, right? And you'd
Mhm.
like to extend that over the course of the whole year and make payments every month, then you would be a good candidate for this. And your insurance company, believe it or not, will be the one that will implement this, and they'll sign you up. Your pharmacist will be able to sign you up. I don't think the pharmacists even know about this yet, but they'll be the ones to sign you up, or the insurance company can sign you up. Us as agents, like we're hearing about it, and but like if your prescriptions are $47 or $100 a month, you're not really a good candidate for this.
Right.
If you can pay it, pay it. But someone who quickly hits that $2,000 maximum, and if they can't pay it, and your
So
insurance company will be billing you for that every month, and you have to pay it.
you have to pay it. So the
Yes.
Part D change, if I caught this correctly, is previously it was $8,000 was the number before you went to catastrophic and everything was covered. Now that number is dropping to 2,000, and then you go to catastrophic and everything is covered. But we don't know how the insurance company is going to offset the cost, because just for the sake of simple math, it's like you're saving $6,000. But
Yeah.
you know,
Right. Right. So
okay,
there, and right now we've got the manufacturers putting in a little bit. There's rebates and things, and so what you pay, if you pay $47 for Eliquis, let's say, right? Well, the actual drug cost of the drug is a lot higher. So there's manufacturer discounts. The insurance company is covering their share, and then you're paying your share, $47, let's say, right? So just remember that the actual drug cost is a lot higher than what you pay as your copay. So
right,
that's all got to be covered somehow.
okay, all right. Well, I think those were our topics for today. So I know that over the next few months, you will continue to be in, I guess, training, not really training, but just classes learning about the new changes that'll be coming forward
Mm.
for the upcoming open enrollment year. So, well,
Yeah.
Ellie, if someone wanted to contact you, how can they reach you?
Well, I'll tell you what, I got a few ways. I have a business page on Facebook, and it's Ellie Jolly, Senior Life Agent, no, Senior Health Agent. I don't even know what it is, right? Ellie Jolly Health Agent, I'm sorry, is the Facebook page, Ellie Jolly Health Agent. And then you can email me at Ellie, ELLI, at ejolly.agency, or you can call me at 470-315-0810, and I'll be glad to help if you just want to make sure you're on the right plan or you're safe when it comes to the drug changes coming. I'll be glad to take a look at that for you. Uh, and I'm actually getting with my clients sooner, right? I want to make sure that I've got everything I need to know. So when October rolls around, we're in a good position to quickly figure out what's best for them. So if you're
And
not an agent, call them.
you are licensed in Georgia as well as,
Ohio, Florida, and Alabama.
okay, so if you're in Ohio, Florida, or Alabama, as well as Georgia, give Ellie a look up. You will be in great hands. And I will also put your contact information in the description of the video so that they'll be able to reach you that way as well, in case they didn't have a pen to write down all the information. So, all righty.
Great. Thank you so much. Thanks for having me. And do not fear. I'm going around telling everyone this, like AEP is it's a little nerve wracking with all the calls. But remember what I said. If someone knows you and is trying to reach you, they will leave you a voicemail. So not answering is your best friend. That is the best way forward. Best advice I can give.
Yep, you're right. All right. Well, thank you, ma'am.
All right. Thank you. Have a good day.